So that's still in the chest area. That's still in the chest area. But mainly today we focus on the breast tissue and the axillary area. So look like we're still in the chest area. We finished the lung and the general chest area and the heart. Now we're moving to the breast tissue and the axillary area. The breast tissue, certainly female, is more important and also easily cause the problems. But occasionally, for male person, still possible health troubles. So basically, for female, the breast tissue is bigger. So in the anterior part of the thoracic wall, basically from the clavicle bone and the second ribs go down to the sixth ribs area. And then from the middle sternal bone to the middle axillary line. So that's the normal breast tissue locations. And normally for different people, their size may be a little bit different. Some people a little bit bigger, some people a little bit smaller, and also they changing, like by the menstruation cycles. They may be like before the menstruations, they got little bit more bigger, little bit more sensitive because hormone changing. And after menstruations, it is getting little bit smaller, but it's not that bigger changing. And their changing also follow the age. Certainly, when people getting aging, the breast tissue getting a little bit smaller, or maybe drooping down. So that's the normal location here. Normal location here. It covers over muscles here. When we learn anatomy, we learn we have muscles in the chest area. So basically, they cover the muscles in front of the chest area. And then we can see under the axillary area, the smaller like this means lymph nodules. We have a lot of small lymph nodules under the axillary area. But normally, we're talking about the normal lymph nodules is smaller, less than ½ centimeter, and softer and hard to touching. But if have some troubles, especially if we separate breast tissues for 4 parts, so especially later upper part get some trouble here. Easily find large lymph nodules under the axillary area. So that's basically this part, lymphs, go to the under axillary tissues. and the nodule there. So that's basically normal location of the breast tissue. Certainly, in the center of the breast tissue, we'll have nipples, and around the nipples, we'll have a dark area. So we say physical examinations, we have 4 ways. The first way, inspection or looking. Second way, palpation. Third way, percussion, 2P here. And fourth way, aspiration. We checking each part of the bodies. We try use 4 ways, but some part of the body we may not like especially the way, especially for percussion, for aspirations, because we didn't have special sounds coming from percussion or aspirations, like in our neck area, inspection and palpation. Same thing for the breast tissue. Truly, we are not need necessary percussion for aspirations. Aspirations is only possible for breast tissue. Some people got enlarged blood vessels there. Maybe you can hear some sounds from there. But generally say we are not use percussion and aspirations for our checking for the breast tissue. So that's the main way, inspection and palpation, when we're checking for the breast. Inspection just looking, inspection just looking. We're looking for the breast and we're looking for the nipples. They should located in the normal positions. So usually we're checking with people sitting there, let it be easily. Truly, some people, like they lay down there, we still can checking. So the first level inspections are looking for the skin. Skin changing. What means skin changing? So basically around the breast tissues, the skin color should be the normal and the same. And we also compare both sides. Both sides of the skin the same color, and the color in different parts they are the same. And also we compare both sides the same size. The shape is normal. It's not usually we're talking about kind of a round shape in there. But if we find some people, like the nipple still in here, but some part is shrinking like this, it must be abnormal. So that's the shape change. That's shape change. Look like they losing some tissue in this part. And we're looking from different sides. Arm side. The arm at the side means arm down. Arm down. And arm overhead. Thus we are more easily to looking lower part of the breast tissue, and the arm against the hip. Let's see, do we have pictures here? And now the special picture here. So arm against the hip. Let's go to the first one. We say we're looking from 4 different way. Arm side, easy understanding. Yeah. Just relax arm by side. Then we checking the breast tissue. So that's the arm. Yeah. Both side, arm side. That's the arm side. Then we say arm over the head. Yeah, arm over the head. So basically put the arm rest over the head. So that way we can see pretty clearly under the axillary area. The arm against the hip, like a patient sitting here, and then put the arm right on the hip area. So that's arm against the hip. And then we checking for different ways. Lean forward. So like put the arm, go to let it be anterior part. So basically we go to different way. We just try to make our checking more easily and more clearly. So then we separate the breast tissue by 4 parts. So that certainly is the right side of the breast here. So that's our normally breast tissue. You can see a little bit tail go to the under axillary area. But the big part in front of the chest. So that's normally. Then through the nipple, through the nipple, we separate the breast tissue for 4 parts. That's the line here. Look like a clock here. Look like a clock here. We face to the clock. We face to the clock. That's like 6 o'clock, 9 o'clock, 12 o'clock, and 3 o'clock. So when we make like a clock here, so basically if we find something in the breast tissue, then we need to recolor it. When we recolor it, then we can say it's located in the 3 o'clock or maybe 12 o'clock. Certainly we still can separate. Here is 1 o'clock, here is 2, and the same thing, 4, 5, 7, 8, and make some line here. That's 10, 11. We could go to more detail. Like which of the clock. Then we find something. We find something in which clock. We also can like a big nodule in some area. If they cover not only 1 clock there, like a big nodule in this area. We also can measure like in the upper inner quadrant. And then we measured how bigger, like 5 times 5 centimeters. A big nodules there. And when we separate the 4 parts, that's the upper inner quadrant, that's the lower inner, and that's the upper outer, that's the lower outer. So that's we say that's the raised breast tissue. How about the left? Still the same thing. Yeah, still the same thing. We still separate with 4 parts, but here is the inner part. Yeah, upper inner. Here is the lower inner. Here is the upper outer. Here is the lower outer. But the clock is still the same. Yeah, clock is still the same. Because that's the way we're looking for the clock. We are not make a measure for the clock. So depending how you measure it, by quarter or maybe by the clock. But when you say the clock, you must say that's on the left side or right side. Then you can separate. So that's basically our breast tissue, and we separate with 4 parts and also with the clock. So these pictures show us by side. So that's the breast tissue. Then we looking by side. Generally say this picture is a patient's breast picture. It's not a normal breast tissue here. So basically, normally we say breast tissue, people will have nipples like this. The nipples right now is shrinking. More go to inside. Yeah. So that's we say retraction size. What can cause the retractions? We know inside the breast tissues, mainly is some small growths in there. They can secretion for the milk. But between, we have some fabric to give it support and maintenance the shape. All the fabric, they are meeting in the nipples area, like radiated to the nipples area. So if something happens, especially for the cancer cells growing in somewhere, then they will pull the fabric go to the local area. So this side is fabric is more tight, go to the tissue, abnormal tissue, they shrink here. So that's why they cause the nipples retracted. So that's basically the size of the cancerous patients. So that's why by the inspections, firstly we looking both sides, nipples if they are normal or abnormal. And also we're looking for the shape of the breast, because if patient has some abnormal growth like the cancer, we can see the whole breast tissue will be changing the shape. So that's the first signs we're looking from the nipples. That's abnormal reactions. So this one we're looking kind of anteriorly, a little bit side by anteriorly. And then we're looking for the skin colors in the breast. So we say skin color in the breast should be normal, but truly in this area, the color is darker, including the nipple area is not good color there. And also locally, it's kind of swollen and edema in there. The skin go to more darker rough there. So basically, you can see some dot on the skin area. And usually this kind of dot coming from the skin, still possible coming because cancers under. So this kind of skin, we give it a special name, urgent kind of size. Means the skin getting darker, and they look like urgent pills. They have some dot in there. So basically, this kind of changing, certainly still sick and changing, but still the size for cancer kind of patient. Still the same reasons we're talking about, some fabric under the tissue, and then because the cancer's growing under, they pull the skin go down. That's caused this kind of urgent pill kind of changing or size in there. So for female patient aging 50 or 60, their hormone changing, the possible cause lot of breast illness. The main illness is the nodule, and nodules they still have two different kinds. One is kind of benign, one is kind of cancer. So cancer is very severe kind of troubles. Usually the size coming from the cancer kind of nodules. So that's basically we're looking, and certainly these ones still abnormal. The shape, we say should be the raw shape. But this one is not a normal shape there. It must be some nodules is under. So that's from the looking, we find abnormal changing. Then we go to detailed checking, and then we try to find something under the skin. So another one, still the nipples retractions here, normally should be like this shape, and also both sides, yeah, is not the same, it's deviation there, yeah. So that's another abnormal change here. So that's basically our inspection part, yeah, basically inspection part. So what we inspections for the breast? We're looking to the shape, we're looking for the skin color, we're looking for the nipples, we're looking for some changes. So that's basically our inspection part for the breast. So that's basically we finish inspection part. Now we're moving to the palpation part. We say for breast tissue, we only have two ways to checking. One is inspection, one is palpation. Inspection just looking, both sides the same, the color, and no special skin and the nipples retractions there. And the palpation, even more important. From the palpation, we can find a lot of problems happens in the breast tissue. So when we say we're looking or inspection the breast tissue, people sitting there usually. But when we palpation for the breast tissue, the patient is better to lay down there, face up. That's the separate. Then we can check in from one quadrant to another quadrant. So basically we checking way with the breast tissue, upper part, start from clavicle bone. So we can checking from clavicle bone and then follow different area go down. Middle part go to sternal bone, and then side part go to axillary line. So that's basically we checking for the breast tissue. And also pay attention the tail of the breast tissue. It's right go under the axillary area. So don't miss that part. And also when we're checking the breast tissues, we can follow some line. Yeah, we can follow some line. So right now we're talking about practitioners. Yeah, practitioner checking for the patients. Later on, we're also talking about the patient itself can checking. So basically, we say we will follow the breast tissues and put our hand more flat over the breast tissues, like from one side of the breast, then upper, then go down, then upper. Or maybe we can start from the nipples. Yeah, we can start from nipples, go to side first. Or you can start from under the axillary tissue and gradually moving to the center of the nipples, and then continually go to side of the sternal bone. Pay attention when we checking patients. Put our hand flatly over the breast tissue. And then moving gradually. Never pinch the breast tissue. If you pinch the breast tissue like everybody's breast, you will find some nodules. That's normal. Yeah, that's normal. But if you put your hand lightly over the breast tissue, then you find some nodules. That will be abnormal. So just pay attention, don't pinching. So that's basically the palpation part. Yeah, basically palpation part. So just like moving your hand slightly, gradually, one by one ear by another ear, and we finish checking one side, then we checking other side, and we always ask patient put their hand over the head, especially when we checking by the side part of the breast tissue, especially we know we have tail of the breast in here. That's more easily to checking. Then when we checking to the middle part, we can ask the patient put a hand over the shoulders. So this way, this part more relaxed. And then we are easily find if we have some trouble there. So that's basically we checking for the breast tissue. So we say breast tissue, the trouble mainly happens in the female, but occasionally still possible happens for the male. Yeah, I heard some male patient, they still have breast cancer. Yeah, it's not that common, but still, and we say we looking the shape changing and also for abnormal growth, especially for the male patient. If some people tell you their breast like suddenly get bigger and bigger recently, pay attention. Yeah, it's not a joke. Yeah, it's not a joke. It's truly maybe something happens. And also we looking for the nipple area. If some abnormal discharging continually coming, certainly it's not during feed the baby, not milk, yeah, not should be like feed the baby. They will have milk, but like people, no baby, and then gradually some like liquid coming from the nipple, especially if blood inside. Yeah, if blood inside, and then coming from the nipples, yeah, some liquid with some blood, red color in there. Pay attention, yeah, pay attention. We must be pay attention. That's truly the early signs of the cancer. Yeah. So we talking about some signs for today for the breast tissue. If some dripping coming from nipple or nipple shrinking or some part of breast tissue shrinking and form the orgy kind of pill in there, shape in there, and the deviation of the breast, that's all the signs some abnormal growth in under. More possible for cancer. Certainly we need more detail or laboratory check, but go to check immediately. Yeah, don't think about that something happens, maybe recover itself. Go to check. Yeah, just in case, especially like over 50 Yes, for female is very common, very common illness. And the breast cancer is curable. Breast cancer treated as early as possible, and it is curable. So that's our nipple part. So then we go to the check for the axillary area. So axillary area, basically we still go to inspection first. So looking for the skin, and each of the axillary area to see it is some skin rashes there, or maybe some inflammation there, and maybe some pigment in there. So generally say any kind of skin changing happens and the axillary area, which is checking. And the mainly part for axillary area is the palpation. So we still only have two ways to checking for the axillary area: inspection and palpation. So palpation still more important. So palpation for the axillary area. Basically we need relax the arms. How the arms can relax? Putting it down. So like if we checking for left side arm is down. Then the muscles there can be relaxed. So like the picture here. So ask a patient the arm down, and then our practitioner's hand can go to deeper part of the axillary area. Then we are easily to find something is under your finger. If you tell the patient arm up, so basically pretty tight here, you are hard to find anything. So that's we say checking axillary area, we need arm down. This difference with we checking for the chest area. And then put the hand, put your hand and checking for the axillary area. So that's there are a lot of words here, but generally say if you look at picture, you are pretty easily and make patients feel comfortable, not make patients uncomfortable. So when we checking, basically we try to find some nodules there. Put your hand or fingers to the chest wall area and the upper and the down, then we try to find some nodules there. So we say normally, even you find some nodules under the axillary area, normally it is softer and smaller. Like before, we talked about less than 0.5 centimeter. And the axillary area maybe a little bit bigger, but still softer, still less than 1 centimeter. And no tenderness, You can feel it, softer in there, but no tenderness, no pain, and small. That's normal. So if bigger, then 1 centimeter, or maybe when you're touching, patient feels some painful in there or tender in there, and even harder, even harder. That's abnormal. That's abnormal. So basically, we just try to separate normal condition and abnormal condition. So that's we separate. Then we're talking about checking the breast itself, patient itself, or we say self-examinations. So that's still pretty important part for the female, especially regular checking. Regular checking. So look like not everybody like regular checking go to doctors for their breast, and we also say breast tissue is pretty easily got some nodule there, some cancer there. So regular self-examinations is important. Then we can find the early stage something changing. Then we go to more checking from the doctors or laboratory checking examinations. Then we can find the trouble if it happens in the breast. So that's we say regularly. Regularly. So what's the way we check it? What's the way we check it? Lay down on the bed, and put a pillow under. So if you check your right side, like a picture here, put a pillow under your right side of the chest, and then you are easily to check it. Then you still follow the line. You still follow the line. Usually we start from under the axillary area and follow the line gradually. Still put your hand flatly over your breast tissue, not pinching the skin, not pinching the tissue. Flatly, and then follow the line. Gradually go down, gradually coming back. Gradually go down, and then gradually coming back. And then over the nipples, and then go to middle side. So that's one side. So picture, you can see this side, this side, until to the middle beside the bone, sternal bone, sternal bone in here. So that's you follow the line gradually to feel the tissue softer everywhere and no especially nodule everywhere. That will be normal. That will be normal. So that's by patient lay down there. By patient lay down there, we can check it like this way. Then you're changing the pillow to other side, and use the other hand. Use right hand checking for left side, left hand checking for the right side. Switch the hand. So that's just the mention. Just the mention. And also we can check it when standing. But not only one way to check it by yourself. Especially when you go to shower. That's easily you can check in for yourself. So when you're standing there, so you still put your hand over your head, and then you still follow the line and gradually pressing in there. Still pay attention, don't pinch the skin or tissue there. And when you finish this side, you change the hand, go to other side, and then still follow. Usually we start under the axillary area. Certainly you go opposite way, still okay. But usually we start from the under axillary area, it's a little bit easier. And then checking. So that's palpation. That's palpation. We also can do inspections by self. Inspection or looking by self. Before or after shower, you face a mirror here. So that means a mirror here. And then you can compare both sides. Should be the same size. Same size. We say no special skin origin kind of pale, kind of changing there. Nipples shape is normal. Breast tissues shape is normal. So that's we say normal. Both sides the same. So basically, we can checking by ourselves, both inspection and palpation. Certainly order doesn't matter. Order doesn't matter. You can do inspection first and then palpation. Or maybe you can do palpation first, then inspection. It doesn't matter. But if you find something wrong, or any changing, see the doctors immediately. So thus we need more further examinations. But basically, if you regularly checking like every month, even every week, so that you can find the early changing, and if something wrong, you can get the early treatment as early as possible. So that's basically self-examinations